Unlocking the Power of CBT and REBT, A Therapist's Guide. Cognitive Behavioral Therapy, CBT, and Rational Emotive Behavior Therapy, REBT, are two prominent therapeutic approaches that have significantly contributed to the field of psychotherapy. Both approaches share commonalities but also possess distinctive characteristics, particularly when it comes to their theoretical underpinnings and intervention strategies. This brief video aims to provide professional counselors and psychotherapists with a comprehensive understanding of the similarities and differences between CBT and REBT, with a particular focus on the nature of their interventions. We will explore how CBT interventions tend to be more empirical and focus more on inferences than REBT tends to be, while REBT interventions are often more philosophical and centered on beliefs rather than inferences. Additionally, we will discuss the advantages and challenges of integrating these two models in practice to enhance the welfare of clients and achieve more robust outcomes for a wider psychotherapy-seeking population. CBT and REBT, a brief overview. CBT, developed by Aaron Beck in the 1960s, is based on the premise that individuals' thoughts, feelings, and behaviors are interconnected. It emphasizes the identification and modification of maladaptive thought patterns and cognitive distortions to promote positive behavioral changes. CBT interventions are rooted in empiricism and rely heavily on evidence-based techniques, such as cognitive restructuring and exposure therapy, to address specific psychological disorders. On the other hand, REBT, founded by Albert Ellis in the 1950s, posits that unhelpful or irrational beliefs underlie much of the emotional distress and dysfunctional behaviors. REBT interventions primarily focus on identifying, challenging, and replacing these unhelpful or irrational beliefs to achieve emotional and behavioral wellness. The therapeutic process often involves philosophical discussions about rationality and the assessment of beliefs' pragmatic, logical, and empirical validity. Interventions in CBT, more empirical and inference-focused. Many CBT interventions are characterized by their empirical nature and emphasis on inferences, although CBT also emphasizes the significance of core beliefs, which tend to be beliefs about the self. Inferences are cognitions that attribute meaning to situations, events, and states of affairs. In CBT, the therapist collaborates with the client to identify and challenge cognitive distortions or irrational inferences. Through techniques like cognitive restructuring, clients learn to reevaluate their thought patterns and replace irrational inferences with more adaptive ones. For example, a client with social anxiety may hold the irrational inference that everyone will think I'm a failure. CBT would involve examining the evidence or probability for this belief and replacing it with more balanced and realistic inferences. Interventions in REBT, more philosophical and belief-centered. REBT interventions, in contrast, tend to be more philosophical in nature and centered on beliefs more than inferences, although REBT does include inferential disputing. Beliefs, in this context, refer to cognitions that don't attribute meaning to phenomena but rather evaluate situations, events, and states of affairs. REBT therapists engage in Socratic and didactic questioning to help clients identify and challenge unhelpful or irrational beliefs, such as demandingness, awfulizing, frustration, intolerance, and global rating of self, others, and the world. The focus is on challenging or disputing these beliefs and encouraging clients to adopt more adaptive and helpful or rational ones. For instance, a client with depression might hold the irrational belief that I must always be perfect. REBT would involve a philosophical discussion to dispute and replace this dysfunctional belief and promote unconditional self-acceptance. Advantages of integrating CBT and REBT. Integrating CBT and REBT in psychotherapy practice can offer several advantages for clients and therapists alike. 1. Holistic approach. Combining the empirical and philosophical aspects of CBT and REBT provides a more comprehensive approach to therapy. Clients can benefit from both empirically based interventions and philosophical insights into their cognitive and emotional processes. 2. Flexibility. Integrating these two models allows therapists to tailor interventions to individual client needs. Some clients may respond better to the empirical techniques of CBT, while others may find the philosophical-based interventions of REBT more beneficial. 3. Enhanced outcomes. The integration of CBT and REBT may lead to more robust therapeutic outcomes, as it addresses both the surface-level cognitive distortions, CBT, and the deeper irrational beliefs, REBT, that contribute to emotional distress and dysfunctional behaviors. Challenges of integrating CBT and REBT. While there are clear advantages to integrating CBT and REBT, there are also challenges to consider. 1. Competence. Therapists must have a strong understanding of both CBT and REBT to effectively integrate these approaches. This requires ongoing training and supervision. 2. Complexity. Integrating two distinct models can be complex and may require additional time and effort during therapy sessions. 3. Client preferences. Some clients may prefer one approach over the other, making it essential for therapists to be flexible and responsive to individual client needs. Conclusion. In summary, CBT and REBT are two influential therapeutic approaches with unique characteristics, especially in terms of their interventions. CBT is known for its empirical and inference-focused interventions, while REBT adopts a more philosophical and belief-centered approach. Integrating these models in psychotherapy can offer a holistic and flexible approach, potentially leading to enhanced therapeutic outcomes for a wider range of clients. For further reading on CBT, professional counselors and psychotherapists can explore books by authors such as Aaron Beck and Judith Beck. For those interested in REBT, works by Albert Ellis and Wendy Dryden provide valuable insights into the theory and practice of rational emotive behavior therapy. Recommended reading: Cognitive Therapy and the Emotional Disorders by Aaron T. Beck. Cognitive Therapy, Basics and Beyond by Judith S. Beck. A Guide to Rational Living by Albert Ellis and Robert A. Harper. The Essential Albert Ellis, Seminal Writings on Psychotherapy, edited by Albert Ellis and Wendy Dryden.